There are other devices out on the market. You'll see intense pulse light therapies. We have an IPL in the office here, and that we generally use on the cosmetic side. And then there's always things that can go wrong in laser sessions. The energies could be set too high, and you can burn a patient. We'll get patients that come in that have been blistered from hair lasers or from bitten fractional treatment. Sometimes you can see some result scarring from a laser. Those are low risks, but they do happen. Anytime you're heating up skin, you do run a risk. You can have skin gets too light after lasering and skin gets too dark. Those would be probably the more common side effects with lasering would be lightening the skin too much, darkening the skin after laser treatment, scarring, which would be low risk, but scarring, infections can happen post-laser. The outcome wasn't not expected. Patients are dissatisfied because they got overpromised on what the laser was going to do. Blistering, which often can result in some scarring. Those are all risks that always are going to be present with the laser. Again, if you're going to somewhere where people have properly been trained and they know which lasers are proper to use in this situation, and the settings are, properly guided and directed, risk is fairly low. But that's, again, that's where the trust comes into the selection of where you're going to get your lasering done. And here we tend to take that as a very high priority, as making sure that everyone is properly trained, devices are upkept properly, and we're treating them with the right device. And not, if we don't have the device that can't work for you, we're not going to treat you. We would refer you to maybe somewhere else that has the proper device that we'd have to use. So those are all aspects that you need to take into consideration when you're looking at laser therapeutics.